Scoliosis. We often hear the term, but do we really know what it is, or better yet, what to do about it? Well, to get those answers, we're joining Dr. George Costanza remotely.
Hi, Kelly. It's a pleasure to be here. I love what I do. I love chiropractic. I love what it does for people, and I'd love the opportunity to talk about it.
Great. Scoliosis. What is scoliosis?
Scoliosis is an abnormal curvature of the spine. Now, from the side, your spine's supposed to be curved. From the front, we're supposed to be perfectly straight. So scoliosis is a curvature this way. It involves curves or abnormalities in 3 dimensions, meaning that you're bent this way and you'll slide to the side, but also the spine will rotate. Makes it very difficult to deal with because of that.
Well, is it defined as a deformity? What causes it?
Well, it is a deformity, and usually it's genetic, although not always. There's genetic deformities in the vertebrae that cause them to grow unevenly, and as the spine grows, unfortunately, as the saying goes, as the twig is bent, so grows the tree. Well, then the spine will grow with this abnormal curvature.
We often hear scoliosis related to children, and it's a thing parents always worry about. You worry about it. My child might have scoliosis. Why in children? Is childhood when it actually develops?
Thank you for asking that question, because genetically is not the only way you can get scoliosis. If you've got a strong gene and it's going to cause a hard scoliosis, it's going to be very challenging to deal with. But you can acquire a scoliosis as well. Many times in my practice I've seen mild cases of scoliosis related to something as simple as one leg being a little shorter than the other. That means that the spine doesn't have a level foundation, the pelvis is tipped a little bit, the spine is going to grow not 90 degrees, going to try to correct itself, and then you've got a scoliosis. I've put lifts inside of a shoe on young children, and their spine straightens out, and they don't end up with a scoliosis. I've also seen scoliosis cases in adolescents and in adults where they have one leg shorter than the other, and unfortunately, when they were a child, if that was corrected, there's a good chance that they would not have scoliosis, or they would have a lot less scoliosis than they do have. So therefore, it's important to have your child's posture, your adolescent's posture checked on a regular basis by a chiropractor, and especially to see if that pelvis is on a level basis.
Well, okay. Is there a certain age you recommend getting your child checked by a chiropractor? 1, 2, day of birth?
Well, for different reasons, you have your child checked from near childbirth, but you're not going to check them for posture and scoliosis when they're still laying in a crib. But when they start to stand, and they start to run around, and they start to fall down and run into walls, and they jump off the kitchen table, that's about the time when you want to start to check them, especially as they get older. Cases I see, a lot of scoliosis starts at around 8 years old. That's young, but it does happen, and definitely when they hit adolescence.
Well, is this something I can see in my own child and evaluate myself, or is it best to leave it to a professional like yourself?
Well, I'll relate a bit of an experience, a personal experience. Scoliosis runs in my family. My own son was walking across the kitchen one time with his shirt off, and I looked, and he didn't look right. And he's got a little touch of it. But I didn't see it for a long time. It's hard to pick up, especially if there's 2 curves. See, when there's 1 curve, it's easy. Shoulders are level. But some scoliosis are 2 curves, a bottom one and a top one, lumbar and thoracic. They cancel each other out, and the shoulders are level, and they're very difficult to see. The right way to check for those is with a good postural examination where you can see skin and bony prominences, and also using a very simple measuring tool called a scoliometer, something that commonly is not used in the nurse's office, and they get missed. Let your chiropractor check it.
Well, that's interesting. I mean, so tell us, how's your son doing now?
Thank you. He's doing very well. We put a lift inside his shoe, and he's holding his own.
Now, chiropractic, how does that fit into all this?
Chiropractic fits in a number of different ways. My experience has been in the lower level or the less severe cases of scoliosis, there are things that can be done. First of all, by leveling off the pelvic base, by improving the child's posture. There are exercises that can be done to support the weaker side of the spine. And by keeping them in alignment, keeping them as mobile as possible, keep the pain levels down.
Well, we talked about scoliosis at a younger age. Can you get it when you're older or just during your childhood?
And that's a very interesting question. There's some new research coming out on that. I think it's 7 or 8% of adolescents have scoliosis, and it's commonly, too commonly thought to be a disease of adolescence. But there's some new research out there and some new talk in the field that upwards of about 30% of adults over the age of 60 years old have scoliosis. It's now called scoliosis de novo. In Latin, I think that means of the new. So the question we ask then is, if 7% of adolescents have scoliosis and 30% of adults over 60, where did that 23% come from? Because it's acquired in adulthood for several different reasons. For an unlevel pelvis, it could be occupational. It's also due to uneven or asymmetric degeneration. As we get older, if our spine's not taken care of, the discs degenerate. Now, if the discs degenerate in an asymmetric fashion, one side more than the other, what's going to happen? It's going to tip. And then the spine above that's going to curve, try to compensate. Now you've got uneven pressure side to side. As it continues to degenerate and we continue the lifestyle that causes that in the first place, and then as we get older, if the bones soften a little bit, you're going to get crumbling and collapse, and that curve is going to increase. I've seen numbers of cases of patients who have treated with me, returned years later. I compare the old x-ray, they had a little bit of a curve, 9 degrees, all of a sudden it's 20, 25 degrees. It happens sometimes in just a number of years. So if the first time you see your chiropractor, there is some unevening, please have your chiropractor check it on a regular basis, keep an eye on it, and do what you can, because it's got a 23% chance of advancing into a full-blown scoliosis, and it will affect you for the rest of your life.
Okay, I mean, I understand chiropractic, but you also mentioned lifestyle. How can that affect scoliosis? And there's something in our lifestyle that can cause or even prevent scoliosis, which would be good if we can prevent it.
During your lifestyle, you have to pay attention to many things. One is posture. Do you tend to lean to one side all the time? Do you like to lean in your car? Is your mouse or your printer all the way over here on your desk, so you're always leaning to that side? Do you have an occupation or perhaps an avocation, a sport you like to play that involves one side of the body all the time? I'm a baseball fan. A pitcher, a batter, the way you throw, it's all to one side. It's not even like skiing is. It's nice and symmetric. If you've had a lot of falls, a lot of trauma, if you have a lot of back pain, there's a reason for it. Get it checked. Maybe it's because you're starting to degenerate rapidly and unevenly.
Well, we're running out of time, and you answered some questions I had related to scoliosis. Is there anything to share with us? Anything else?
I'm going to steal something from Thomas Edison. An ounce of prevention is worth a pound of cure. If you're having a problem, if you have a little bit of pain, if you have some tingling in your leg, or you know someone who does, get it checked. Your chiropractor would love to check you.
Great. Dr. Costanza, thank you so much for taking the time out of your busy schedule to join us. It's been a real pleasure talking with you.
Kelly, thank you. It was a pleasure. Whatever I can do to educate people about what chiropractors do about a better lifestyle, it's my pleasure.
Great. Thank you. Great words to remember. An ounce of prevention is worth a pound of cure. Isn't that right? We'll be right back.